So we're going to talk about TRT today, testosterone replacement therapy. HRT, it's for men who suffer from low T or a decline in natural testosterone. So how would you know if you have a decline in testosterone? Well, people aged 30 plus can often talk about fatigue, finding it hard to build and maintain muscle, this almost like the daily grind, like they're trudging through mud. They might suffer from low libido, very low mood. One of the causes for all of these can be low levels of testosterone. Now, testosterone we have from our teens right the way through our life, but it declines. It really starts declining, I think, in your 20s, definitely your 30s. You're primed in your late teens and very early 20s. This is kind of when it's at its absolute peak. Now, as we age, obviously our body is not producing as much as we would have when we're younger. And like I say, this can lead to all those other symptoms. So what can we do about this? Well, if you think this could be an issue for you, you can go and have yourself tested. Now, I say this from experience here that your GP will most likely not be interested in this at all. It's not something they know very much about. I mean, if you speak to any woman that has gone through the menopause and you speak to her about HRT, half the time the doctor is very reluctant, doesn't even able to provide them with adequate help. And that's for women, let alone for men, which this is a fairly new thing to become more widespread and publicised, but our GPs have still not caught up. So what does that leave you with? Well, there's a number of online places, and of course there's private doctors and clinics up and down the country now that you can get easy access to. I will say again, through experience, the cheaper the test, the worse the accuracy of the results and the worse the feedback is. Because something you have to think about, you buy something off Instagram, £50 and we're going to tell you whether you have low testosterone or not. I did this about 10 years ago and they just came back and said, oh, you're in range. And I was like, in range for what? You know, it was almost like a call center calling you back, phoning you back to give you these results. Oh, just you're in the normal range for your age. You know, it helps you with nothing. Then you can, hopefully you'll find somewhere that's a lot better. They won't just test your testosterone, because if they do, you're missing a huge part of the puzzle, because some of your symptoms may be down to something else. So yes, it could fit the narrative of you have low testosterone, but it might be something else that's causing it. So you want to get a full hormone panel, get your bloods done, all of this. Now, unfortunately, that means money. You know, you have to invest in your health to get the best from it, to find out what the underlying issues are. Even putting the testosterone to the side, taking control of your own health, your own well-being, because sadly with the state of the NHS and how busy GPs are, you just will not get what you want without investing. Why would you not want to invest in your body and your health? To know things. And it's not like scaremongering. For example, one of the latest tests I got, vitamin D was lumped in there, and it would seem my vitamin D is quite high. I have to think to myself, do I need to keep supplementing that? Do I need to take it in such a high dose? Can I drop it down? Because a lot of the times, I mean, vitamin D is not a great example, because obviously in the UK with such poor sunlight, we're almost always going to be not have a good level of that. It's always going to be low. But there's other things, there's other vitamins you might need to supplement, but only for a small while, that you're able to do 3 or 4 months, maybe even less, and it can raise these levels. Because at the end of the day, we should be looking to have a varied diet to get the most out of our micronutrients. But there's some areas where we are always just going to be deficient. One of them, for example, is folic acid. The doctor I was speaking to that did my bloods recently, he just said, with the state of the soil in the UK where your vegetables are grown, you will always be deficient in folic acid. And it's a funny one, because I always thought folic acid would just be for females. You know, that's what you hear about women. Women are want to get pregnant. What do they have to take? Folic acid. But no, it's for heart health. So if you're not already on that, get on that. We'll come back to TRT. So we find a reputable clinic or GP, private doctor, go for your tests, get that done, have it analysed. Now, off the back of this, you're going to be advised, maybe there'll be some lifestyle choices that you can adopt to help raise your testosterone naturally, if maybe your testosterone's fine. If it's low, then what are your options? Okay, well, you can look to supplement your natural testosterone in a variety of methods. There are injections, there are pellets, there are gels, there are patches, all with pluses and minuses. And this would be something that you would then be looking to carry out for as long as you see fit. It's not going to be a year. It's going to probably be the rest of your life, for example. But I mean, it depends if you want to still adopt this approach in your 60s and your 70s. You may just think, oh, it's fine. I can deal with feeling a bit under the weather, so to speak. That's natural at that age. But yeah, that is what it pretty much means. You are going to be bound to a life of testosterone therapy. Well, there's something to think about there, because it all seems fun and games when you start this. That if you're having to inject yourself weekly, monthly, sometimes more than once a week, there are certain protocols you go on, you could be injecting 2 to 3 times per week, microdosing very small amounts. It gets boring very quickly. It becomes a chore. It can be annoying when you go away with work, when you go on holiday, for example, having to transport stuff. But obviously, the pluses to it are it can eradicate a lot of the feelings that you had prior. Like I say, the loss of libido, the fatigue. You then retain some more mental clarity. It can be a small price to pay, I'm just saying. I don't think it's all positives. Another thing to think about is people often think that you're meant to feel like what you did in your 20s. I really disagree. That is not testosterone replacement therapy, because when you start this, you're not reliving your youth. You're not going to go back and feel like you did when you were 21. You're topping it up to where you should be naturally and to where your mood is lifted, etc. It's up to the individual, because when speaking to the doctors, there's not really a huge consensus on what is a normal level for particular ages. They can say it's within this range, but again, we're all different and it's hormonal. There's a lot of fine-tuning to be done, and this can take a lot of time, and often this can be something that puts a lot of people off as well. It's not like just swallowing a cod liver oil tablet, take 3, take 5. This is like, oh my goodness, I've got to inject myself this amount, I've got to work it all out, which can be a bit troublesome in the beginning, and then I got to monitor how I feel for the next few days to weeks, and then do I make any differences? Do I increase it? Oh, I didn't, that was too much, I got to bring it back. So it's almost like you're experimenting. But like I say, it's the positives far outweigh the negatives. But you must always, I strongly urge you always have to look at somebody reputable, because there's so many people you see on Instagram now, guys in gyms that are just gym monkeys that are now charging people for hormonal advice. I mean, I wouldn't let somebody work on my car that had their own car and he tinkered with it, for example. You want somebody that has a bit of background and knowledge. And I know you can argue that there are people like this, but come on, this is your health. This is the really real world. You want somebody that has some medical training and can read research papers and comprehend them, has some real world experience, or has worked with a lot of people in the real world to work out what is best before you start injecting into your system. Don't be listening to some gym bro. I wouldn't go and get Botox of somebody that wasn't medically trained, for example, that just did it to themselves and went, oh yeah, mine's looks fine. I can advise you, I'll do it for you. You'd think that was ludicrous. Yet there's so many people, I know lots that just see some guy on Instagram, oh, he looks jacked, he takes steroids, he's going to advise me, it's only going to cost me £50. He's actually going to send me this stuff. So you want to stay well clear of that stuff. Because like I say, it's testosterone, it's a steroid, and they have terrible connotations like it's some dirty drug. But now in the medical world and the TRT, it's becoming clean and fashionable now. So you want to do it reputably. You don't want to take that and be working with some guy in the gutter. So like I say, if you're suffering from those symptoms and you think this is something you can benefit from, get yourself tested, speak to somebody at the other end of it, someone that's going to go through all your results with you, not just your testosterone, because like I say, that does not tell the whole picture, because there's lifestyle changes you can make as well to naturally raise your testosterone. Like, for example, people don't want to hear it, but you can reduce your alcohol consumption, you can lose some body fat, you can sleep, you can get your sleep sorted out and go to bed at the same time every night, pretty much. Wake up at the same time every morning, regulate your sleep pattern. All of this will naturally raise your testosterone. But often people don't want to hear about that because it's hard work. They would rather start injecting themselves. They see that as the easier option. Speak with someone who's qualified, who you feel comfortable with. Do your research. Don't just jump into this. And when they go through your results, they or should be going over everything with the whole picture in mind and be able to advise you and make you feel the best you can. Hopefully it's something you're not going to have to do for years, because like I say, once you jump on this horse, you ain't coming off.